anyone can come to get a massage. If you want your insurance or anything, if you're using insurance, you would have to have a prescription for that. But anyone can come in to get a massage at any time. Let's say you're injured in your lower back, then the first thing you would do would see a medical or a chiropractor or whatever you see to find out what is the problem. You would want to know the diagnosis. Now, everybody doesn't go to their doctor for back pain. They do other things first, and because most of us don't like running to the doctor for everything. But if it continues and you're not getting relief with whatever you're doing at home, then you need to go and have it diagnosed with the, x-rays, evaluation, the MRIs, whatever they need to do. And then from there, they can determine whether massage would benefit. Not a long time ago, probably 10 years ago, I had a woman come to me, and she had that painful look that you can just recognize. And I went out and greeted her, and I said, "May I help you?" And she said, I've been to 2 orthopedists, 2 neurologists, 2 chiropractors, physical therapy, pain management, and she says, "I just don't know what to do." And I said, "Well, what's the problem?" And she said, "Well, I've had a migraine for the biggest part of 5 years, steady." She was on medication, and the medication gave her an ulcer, and the ulcer medication gave her chronic diarrhea. So she had a migraine, an ulcer, and chronic diarrhea, and has had this for 5 years. So I worked on her for a solid hour, and I never got below her neck. I just worked on her head and checked all kinds of things, her jaw and all kinds of things. Some of it was pretty intense with her, but we just went through it. So I sent her home on Friday and worried about her all weekend long. And when she came in on Monday, I'm kind of peeking around the corner looking at her, and I said, "So how are you?" And she said, "I went home," and she said, "I had things twitching and vibrating in my head and my neck, and I laid there and I just thought, okay, I don't know what's going on." But she said it was all okay because I didn't have a headache. And she said, "And I haven't had one since I've been here." Now, they came back off and on, but she came to me very religiously for off and on, probably for a year. But the times got fewer and fewer and fewer between. And she'd have been in a hay wagon as a child, and it escaped, and she was, up on the wagon, and it hit a tree, and all of this hay piled on her, and she'd had a really severe head and neck injury that had never been treated. So part of what I did was just help normalize some of the tissues in her head and neck, and it was just one of those wonderful things that happened. So that made it all fun.